Hello friends. Hello friends. Are you suffering from knee joint pains? Do you know what is required to do and how this occurs? Actually, the knee is the largest joint in our body and it is made up of four main things: bones, ligaments, cartilage and tendons. So the knee joint is formed where the three bones meet, which mean to say the thigh bone, the the shin bone and the kneecap. The kneecap is also called the patella. So these join bones to what are ligaments actually? The ligaments actually join the bones to other bones. So they are like connecting wires or connecting soft muscle tissues which connect the one bone to the other. And there are four main ligaments in the knee and they act as strong ropes to hold the bones together and keep the knee in place. So the ligaments in the knee are collateral ligaments, which are found on the sides of your knee, and one is on the inside and one is on the outside. So they control the sideways movements of your knee. Cruciate ligaments are which are found inside your knee joint. They cross each other to form an X shape. These ligaments control how your knee moves backwards and forwards. Now, what are cartilage? Cartilage, there are two types of cartilage in the knee. One is the articular cartilage. This covers the ends of the thigh bone and the shin bone and the back of the kneecap. This is a slippery substance that helps your knee bones glide smoothly across each other as you bend or straighten your leg. Then there is the meniscal cartilage. It is also called meniscus. So these are two wedge-shaped pieces that act as shock absorbers between your shin bone and thigh bone. The medial meniscus is on the inner side of the knee joint and the lateral meniscus is on the outer side of the knee. The meniscus actually helps to cushion and stabilize the joint, which is why they are tough and rubbery. So when people say they have torn cartilage in the knee, they are usually talking about the torn meniscus. The tendons, these actually connect muscles to the bones. So what we need to understand is the knee injuries that happens, it may be sprains or strains and tears, are all different kinds of knee injury. So these can be caused due to sports injuries, or if you might have slipped or fallen down or something. So these knees injuries happen. And painful knees can be a sign of tendonitis. This is when a tendon swells up and becomes painful. So that could also be the reason of the knee joint pains. So the question is, we tend to guess or doubt that the knee joint pains that is happening could be arthritis. So is that true? So knee pain can actually develop over time, might come on suddenly or might repeatedly come and go. Whatever the pattern the pain has, it is actually most often not due to arthritis, but might be in some people. Sometimes it is also hereditary and sometimes it might have developed due to bad lifestyle habits and eating habits. So osteoarthritis is the most common type of arthritis. It can affect anyone at any stage, at any age. But most commonly it is above the age of 50. But if you have before that, it is of course very, it is a concern that you should take care of it. So the pain might feel worse at the end of the day or when you move your knee, and it might improve when you rest. You might have some stiffness in the morning, but this won't usually last more than half an hour. So sometimes it happens then when you get up from the bed, and you have actually not being able to keep your foot down on the ground, and it takes time for you maybe you sit down on the bed and do some exercises, try to move your knees and legs, so that the stiffness goes off, and only then you can put your foot down. So this might take around half an hour to 45 minutes, that exercise that you need to do, so that your joints are free and you are able to keep your foot on the ground. So how do we manage this? So to manage is, you actually need to do some changes, like avoid lifting any heavy weights or something, and actually do some low impact exercise such as cycling and swimming can be useful when recovering from a knee injury. The most important thing is the weight management. So if you're having knee pains, then the most important thing that you need to take care of is your weight. If you have increased your weight, you are overweight or you're obese, you are likely to have joint pains. So you need to actually lose weight, and losing weight is actually not so difficult. You need to make some lifestyle changes in your eating habits, in your eating patterns, in your sleep, in your stress, in your work, at your home, so that all of this are actually responsible, and that will actually help you to reduce weight. Sometimes you might be putting heat or ice packs on your knee so that it becomes easy for you. Sometimes you might be having a painkiller, sometimes you might be having some anti-inflammatory drugs, tablets, or steroids also. Sometimes the doctor also gives steroids. But you know what, all these or whatever medicines you might be taking, it will actually leave residues in your body. It might give you immediate relief, but it might definitely leave the residues in your body, which might erupt in another way with some other problems in your over a period of time. So what is required is you need to take care of all of your diet, of your exercise, of your complete food that you should be having. So you should definitely get in touch with a dietitian or a nutritionist who can help you and help you with this. This will of course take time, because you have also developed it over a period of time. So the reversal or the curing of the knee pain might take time, so you need to have patience, and you actually need to listen to your dietitian and look after it and take care of it. So thank you for being with me, and thanks for encouraging me. Looking forward to meeting you. This is Vinita Sinha. I am a certified nutritionist.